Adjuvant therapy is, in melanoma as well as in other cancers, is the fact that you treat patients just after surgery to improve the results of surgery, to improve the survival of patients. So it can be done at different phases of the diseases, but in melanoma it's currently validated after the resection of nodal disease. With both of the treatment, immunotherapy, anti-PD-1 or BRAF/MEK inhibitors, the results show that risk of relapse is decreased by roughly 50%, which is a very big effect on the course of the disease. The benefit in survival is not yet really shown, but it can be deduced from the fact that these treatments are able to delay or reduce the risk of distant metastasis. So if you delay distant metastasis, you should delay death at the end. The trials have enrolled patients with what we call AJCC 3A to 3C patients. And one trial has also included a specific subgroup of stage 4. But basically that means that they are all patients with a positive sentinel node or bulky nodal disease. There is a new field which is opening, which is called Neoadjuvant. And Neoadjuvant means that you start the adjuvant therapy before surgery. So usually neoadjuvant is to permit surgery to be easier, and if the surgery is easier, you expect that it will be more complete, so that the result will be more favorable. But basically now we have proofs that the neoadjuvant strategy is able to treat the disease itself, and it might be that in a way neoadjuvant could help us to get rid of surgery in the future. We have two types of drugs, which are immunotherapy on one side and BRAF/MEK inhibitors on the other, which have proven to be quite effective in the management of metastatic patients with multiple metastases. And these two drugs have now been tested in the adjuvant setting. That means that they are used earlier in the disease, in the natural history of the disease, when the patient has only a nodal disease, a regional disease, which could be limited, for instance, to a positive sentinel node. And in this given situation, these drugs are able to decrease the risk of relapse by 50%, which is really a fantastic result.